The next letter is L for Lochia. So that is the blood that is coming out of the vagina post-delivery. So the things that we're going to be looking for the Lochia is the color. So are we at the point where post-delivery it's pretty recent, and so is the Lochia red, like a normal amount? Well, I won't go into amount yet. So is the Lochia red, or is it been like a couple days now, and one day after, and the color is more serosa, which is more of like more of like a pinkish red, clearish. It's kind of in between. And then you have the alba color, which is where it's just more of the clearish fluid that's coming out. Still some type of vaginal discharge, but no longer the bright red that they may have had the day of delivery, or that night of delivery. And then the amount. So do we have none? Do we have a scant amount? Do we have a small amount, moderate amount, heavy amount? And again, what we always try to tell our patients is that most times a patient will tell you, I've got a large amount out. And that's because they haven't seen this kind of blood or this amount of blood, maybe even during a normal period. So what they think is a large amount may be to us more on the small to maybe moderate amount. It just kind of depends. I think more of a heavier amount is close to filling up one of their pads that we give them, filling that up within 1 hour. So if they get to that point where they're changing it hourly, then we have a problem, because that's a little bit too much bleeding, and then we could be going into some possibilities of postpartum hemorrhage that the patient might be having. So it's important to always know how much Lochia your patient is having. It's always good to check and talk and communicate with your patient. So the next thing that you want to do with Lochia is to check also, are there any clots present? If so, explain, ask them to explain what does it look like. Or if they see a clot, tell them to leave it in the toilet so you can take a look at it. And we want to try to make sure that we aren't getting to a point where it's larger than like a golf ball or larger. Sometimes even up to a golf ball is still something that we want to know about, but may not be that important. It kind of just depends on how often, how many has she had. Most times clots are present, usually the size of like a pencil eraser or something that's visible, but not something that's alarming. Again, the patient may tell you that, oh, it's a lot of clots, but really it's just a few of these smaller ones, and not something to be too concerned with. And then also with Lochia, we're looking for odor, and whether there's an odor that's present or if it's absent. So some women just have a vaginal odor that they're aware of that is a normal for them, and some smell something that just smells off or different, and that's kind of what we're looking for. And we can also smell that while we're doing the assessment, so those are things that we're also keeping track of.